Bismillahirrahmanirrahim. Assalamu alaikum, everyone. I am Dr. Alishba Rasool, PGR Community Medicine, and I will be presenting a critical appraisal of a journal article under the kind supervision of Professor Dr. Saira Afzal. A research article. The title of the article is Dietary Fiber in Hypertension and Cardiovascular Disease Management, a Systematic Review and Meta-Analysis. I will be using the PRISMA checklist for my critical appraisal. This is the PRISMA checklist. It is a 27-item checklist. Now, title, Dietary Fiber and Hypertension and Cardiovascular Disease Management, Systematic Review and Meta-Analysis. It does identify the report as a systematic review. This is the PRISMA guideline for the abstract. Abstract, higher dietary fiber intakes are associated with a reduced risk of developing cardiovascular disease, and increasing intake has been shown to reduce blood pressure and other cardiometabolic risk factors. The extent to which the dietary fiber can further reduce the risk for those with CVD and treated with cardioprotective drugs have not been clearly established. We have examined the evidence for dietary fiber as an adjunct therapy in those with CVD or hypertension. Methods. Ovid, Medline, Embase, PubMed, and Central were searched to June 2021. Prospective observational studies reporting on fiber intakes and mortality in those with pre-existing CVD and controlled trials of increasing fiber intakes on cardiometabolic risk factors in those with CVD or hypertension were eligible. Outcomes were mortality and cardiometabolic risk factors. Data synthesis was with random effects and dose response. Certainty of evidence was assessed using the grade. Results. 3 prospective studies, including 7,469 adults with CVD, 12 trials of 878 adults with CVD or hypertension were identified. Moderate certainty evidence indicates reduced all-cause mortality when comparing higher with lower fiber intakes. Low certainty evidence from trials of adults with cardiovascular disease indicates increasing fiber intakes reduce total mean and low-density lipoprotein. High certainty evidence from trials of adults with hypertension indicates increasing fiber intakes reduces systolic and diastolic blood pressure. Moderate and low certainty evidence indicates improvements in fasting blood glucose and LDL cholesterol. Benefits were observed irrespective of cardioprotective drug use. These findings emphasize the likely benefits of promoting the greater dietary fiber intakes for patients with CVD and hypertension. Further trials and cohort analysis in the area would increase confidence in these results. Now we will be critically appraising the abstract using the PRISMA checklist. It does not provide an explicit objective, mentions the eligibility criteria, mentions the databases used and dates when each were last searched, does not mention the methods used to assess the risk of bias in the included study, mentions the method used for the data synthesis, gives the total number of included studies and participants, does not summarize the relevant characteristics of each study, present results for the main outcome for each study and confidence intervals for the meta-analysis, does not get limitations for evidence included in the review, provide a general interpretations of the result and implication, no funding source and registration number or name is mentioned in the abstract. Introduction. Cardiovascular disease is the leading cause of morbidity and mortality. We have identified comparable benefits in the management of adults with type 1 and type 2. Active pharmacological management of cardiometabolic risk in patients with established cardiovascular disease has reduced the risk of further cardiovascular events and improved survival. The extent to which the dietary fiber can further reduce the risk for those with CVD and treated with cardioprotective drugs following an acute event has not been clearly established. We have addressed this gap in the literature by conducting a systematic review and meta-analysis of the available data. As many of those with diagnosed CVD or hypertension are likely to be treated on cardioprotective medication, this research is intended to determine the extent to which the dietary fiber is a useful adjunct to the pharmacological management of this high-risk group of patients. Now, the critical appraisal of the introduction using PRISMA. It gives the rationale for the review in light of existing knowledge, and it provides an explicit statement of objective in the review addresses. Methods. Ovid, Medline, Embase, PubMed, and the Cochrane Central Register of Control Trials were searched up to 10 June. The online search was augmented by hand searching of reference lists to identify other Potentially eligible publication. Data from the eligible studies were extracted by one reviewer into an Excel spreadsheet template used in a previous review with the second reviewer and then checking each cell. The most adjusted values for the effect size were extracted for cohort studies, while baseline and post-intervention data were extracted for the controlled trials. Risk of bias in the eligible studies was assessed with the Newcastle-Ottawa scale. Trials were assessed with the Cochrane risk of bias tool by two reviewers independent of each other. We considered the heterogeneity between the repeated results of individual studies and trials with the 12 statistic and the Q test. However, because there are overall measures unable to provide insight on the sources of heterogeneity, we applied meta-regression analysis of the effect sizes standardized to the same does to the considered the potential heterogeneous sources for outcomes with four or more trial arms pooled. Analysis were performed in the statistical software using the meta-bias, meta-trim, meta-in, and meta-reg commands. After producing the pooled estimate for each outcome, we used the grading of recommendations, assessment, development, evaluation protocols to calculate the absolute risk reduction from prospective observational study data and evaluate the certainty of the body of evidence for each outcome. Now we will be critically appraising the methods using the PRISMA. Specifies the inclusion and exclusion criteria for the review. Specifies all the databases, registers, websites, reference lists, and other sources searched or consulted to identify the studies. Specifies the date when each source was last searched or consulted. Presents the full search strategy for all the databases, registers, and websites, including any filters or limits used. Specifies the methods used to describe whether a study met the inclusion criteria of the review, including how many reviewers screen each record and each report retrieved, whether they work independently, and if applicable, details of the automation tools used in the process. Specified the methods used to collect data from reports, including how many reviewers collected data from each report, whether they work independently, and processes for obtaining or confirming the data from study investigators, and if applicable, details of automation tools used in the process. Specifies the method used to assess the risk of bias in the included studies, including the details of the tools. Lists and defines all outcomes and variables for which the data were sought. Describe the processes used to describe which studies were eligible for each synthesis. Does not describe any methods required to prepare the data for preparation or synthesis, such as handling of missing summary stats. Describes the model methods to identify the presence and extent of statistical heterogeneity and software package used. Describe any method used to explain the possible causes of heterogeneity among study results. Does not describe any method used to assess the risk of bias due to missing results in a synthesis. Describe the methods used to assess the certainty in the body of evidence for an outcome. Now it's time for the results. A 25% reduction in all-cause mortality was observed for those consuming the most fiber when compared with those consuming the least. In terms of absolute risk, this translated into 60 fewer deaths per 1,000 participants for higher fiber consumers. Assuming linearity, there was a 14% risk reduction for every additional 10 grams of fiber consumed. The available data indicate increasing fiber intake improves measures of the total and LDL cholesterol, blood pressure, blood glucose, and body weight. Also, there was a high initial heterogeneity. There were insufficient data to explore with meta-regression, so the certainty of evidence for each outcome was downgraded once for the inconsistency. Results indicated improvements in the systolic and diastolic blood pressure. LDL cholesterol sensitivity analysis could not account for any one factor contributing to the initial heterogeneity. However, each point estimate within the meta-analysis indicate a benefit with higher fiber intake, suggesting heterogeneity was likely due to specificity of point estimates rather than any known underlying factor. Meta-regression analysis indicated that the fiber source influenced the pooled result for total cholesterol with greater benefits from food sources rather than supplements, with the 12 reduced to 68%. The certainty of evidence for blood lipids outcomes was assessed as low following downgrading for the imprecision and inconsistency. The data for an improvement in fasting blood glucose was assessed as moderate following a single downgrade for inconsistency, although all sensitivity analysis indicating the finding was robust. Describes the results of the search and selection process from the. Now we will be discussing our results using the PRISMA. Describes the results of the search and selection process from the number of records identified in the search to the number of studies included in the review using a flow diagram. Cite studies that might appear to meet the inclusion criteria but which were excluded and explained why they were excluded. Does not cite each included study individually and presents its characteristics in a table format. For all the outcome present for each study gives the summary statistics for each group, an effect estimate and its precision using the structured tables or plots. Presents results of all the statistical synthesis conducted. For the meta-analysis conducted, presents for each the summary estimate and its precision and measures of statistical heterogeneity for comparing groups, describe the direction of the effect. Presents the results of all the investigations of possible causes of heterogeneity among the studied results. Present results of all the sensitivity analysis conducted to assess the robustness of the synthesized result. Does not present assessment of the risk of bias due to missing results arising from the reporting bias for each synthesis assessed. Discussion. The present study has many strengths, primarily the parallel consideration of the effects of increasing fiber intake from the control trials and higher fiber intakes in the prospective cohort studies enabled us to consider the mechanism supporting hard outcomes. To our knowledge, this is the first meta-analysis to consider fiber for CVD and hypertension management, adding novelty to our work. The primary limitation of this work was the lack of relevant data available. Although only 4 cohort studies were identified, it is never possible to fully exclude confounding from the observational study. Follow-up duration was reasonable, and the cohorts were conducted in 3 distinct populations. Trials were generally of a limited number of participants, with the majority of studies of 12 weeks duration. We varied from the protocol of this review by considering only trials of at least 6 weeks intervention duration rather than the stated 2 weeks. This decision was made before the searches were conducted to better consider meaningful change in a broader range of cardiometabolic risk factors beyond blood lipids and blood pressure. The findings from this meta-analysis support the incorporation of the high-fiber foods in CBD and hypertension management, with improvement in the cardiometabolic risk factors supporting the observed reduction in the premature mortality. Now we will be critically appraising the discussion using the PRISMA. It provides a general interpretation of the results in the context of other evidence. It discusses limitations of the evidence included in the review. It discusses the limitations of the review processes used. It discusses the implications of the results for practice, policy, and future research. Other information provides the registration number information for the review, including the register name and the registration number. Indicate where the review protocol can be accessed or state that the protocol was not prepared. It mentions the funding source. It declares the competing interests of the competing interests of the review authors. It reports the availability of the data and materials used in this review. Overall, it was a very nicely written article with a very few limitations. Now we will be discussing the overall strengths and weaknesses from our critical appraisal. So the strengths were a very strong rationale in the introduction, a very well-explained methodology specifying the inclusion and exclusion criteria, the databases used, dates when they were last searched, the screening process, that how the studies were included, and how were they reviewed, specified the methods used to assess the risk of bias in the included studies, and listed and defined all the outcomes and variables for which the data were sought. It described the results of the search and selection process from the numbers of records identified in the search to the numbers of studies included in the review using a flow diagram, which was the PRISMA diagram. Present results of all the statistical synthesis conducted for the meta-analysis conducted, presents for each the summary estimate and its precision, the confidence credible interval, and measures of the statistical heterogeneity. For comparing the groups, describes the direction of the effect. Present results of all the investigations of possible causes of heterogeneity among the study results. Discussion gave a general interpretation of the results, addressed the strengths and limitations of the review, and gave implications for the future policy and research. As I mentioned earlier, it was a very well-written article with a very few weaknesses or limitations. It doesn't describe any method required to prepare the data for presentation or synthesis, such as handling of the missing summary stats. It does not describe any method used to assess the risk of bias due to missing results in the synthesis arising from reporting biases. It does not cite each included study individually in a table format and present its characteristics. It does not present assessment of the risk of bias due to missing results arising from the reporting biases for each synthesis assessed. Thank you, everyone. Please like, share, subscribe to our YouTube channel.
Thank you very much, Dr. Alishba. Very nice presentation. And I was thinking that such a good systematic review has been presented that has a lot of learning lessons for us too. So I would suggest all those who are doing systematic reviews, they must get their systematic reviews registered on Prospero website. I hope everyone knows about Prospero. Am I right?
Yes, madam.
Do you know how to register a systematic review?
Madam, we haven't registered, but Dr.
Right.
Amber mentioned it, like she told us how to.
Very nice. So I would suggest that all of you who are yes working on systematic reviews, please do register with Prospero today, and let me know that we have registered with the Prospero the systematic reviews that you have prepared for the conference, that is Pakistan Association of Medical Editors Conference. You all should register for it. The second learning lesson is that the important uh, even research that has published in a good journal, still it has lot of weaknesses. So there were many weaknesses, and they are highlighted by Dr. Alishba very well. So very well done, Dr. Alishba. A very nice presentation today, and it has a lot of learning lessons for each of us, and the action points too. And the most important action point is that we must register our systematic reviews in Prospero. That is the site where the systematic reviews are registered. So thank you very much. Very well done. Allah Hafiz.
Allah Hafiz, madam.
Allah Hafiz, ma'am.